mind, and I know you've heard this how many times now?
18, 20.
It's really only been 3, but it feels like it. Okay. Coumadin is, as we kind of facetiously point out, is rat poison. What happens is the little mice eat the Coumadin, and it causes massive bleeding, and then they pass away, a little mouse. And we use Coumadin, though, in very carefully adjusted doses. It's an anticoagulant and protects us from clotting. But it has to be very carefully adjusted. And most medical doctors are extremely good at managing the dosages of Coumadin, and because it's so critical, and they're good at it. They've got a team of people, and they're all ready to manage it. And so Coumadin management is something your average medical doctor has to deal with all the time, and they do deal with it in superb fashion. On the other hand, the MGB throws a monkey wrench into that whole system. Coumadin acts to interfere with the synthesis of vitamin K-dependent clotting factors. And if you're getting the right amount of vitamin K in, and you put just the right amount of Coumadin in, you decrease your clotting a bit, but not too much. And that's the perfect balance. If you take too much Coumadin in, though, you can throw everything out, and then you don't clot normally, and even the slightest bump can lead to massive bleeding and potentially even death. So Coumadin you have to treat with intense respect, as you have suffered me talking about this so many times, so we're going to do it one more time. Now, what we're about to do is take his perfectly balanced system of Coumadin, 5 milligrams on Monday, Wednesday, and Friday, and 7.5 milligrams on Tuesday, Thursday, and Sundays and Saturdays, or something like that? Roughly.
That's actually 7.5 and 10.
7.5 and 10, so, I'm sorry. And we're going to throw all that off because of the MGB. The MGB decreases your intake of vitamin K because you don't have much in the way of green leafy vegetables. So your coags are going to be out. And what happens is, if you go back into the hands of your local doctor and they're not familiar with the MGB, we have had patients have major bleeding complications, as we talked about. So it means that you and I have to communicate, your doctor and I need to communicate, you and I and your doctor have to communicate over and over again to tell him, tell you, and family the following. It's likely that you need many more adjustments and many more measurements of your coagulation system in the coming 3 months than you've ever needed in the past. And it's likely that when your doctor thinks you got everything adjusted just right, that the MGB is going to sneak in and blow up your clotting factors, and you're going to go way out. So we want to talk with you, express to you this constant attention to your coag levels during the next 3 months and maybe longer. To be very cautious, to repeatedly measure that so that we don't have a major bleeding complication. Well, this is kind of just special for you, but we did get it on video, so maybe it'll help somebody else about it. Other questions that you and I have to go over or discuss? And
No.
Good. Take your staples out?
Sure.
Okay, good.